In Madrid, nurses protested today outside the hospital where a nurse's assistant is being treated for Ebola. She's the first person to contract the virus outside West Africa. They're demanding better protection against the disease. Nurses and first responders in the U.S. are concerned as well, and here's John Blackstone.
For healthcare workers, the Ebola virus presents a deadly threat, beginning with first responders. Crystal Wilfong is an emergency medical technician in North Carolina.
We never know what we're walking into on an emergency, especially when someone invites us into their home who exhibits these symptoms.
The Centers for Disease Control has issued a detailed checklist to hospitals specifying how to respond to potential Ebola carriers.
We are the nurses!
But in Las Vegas, nurses marched, demonstrating their concern the measures aren't being put into effect quickly enough. And across the country, of more than 1,600 nurses who responded to an online survey by National Nurses United, 77% say their hospital has not communicated to them any policy regarding potential admission of patients infected by Ebola. Katie Romer has worked as a nurse in California for 20 years.
We want to make sure that we have the correct equipment, right, the protective equipment to protect both our patients and ourselves.
Do you have hazmat suits available to you now?
Not that I know of.
While healthcare workers in Africa have been seen in full hazmat gear, the CDC's guidance calls for only the use of face masks, gloves, and fluid-resistant gowns. At San Francisco General Hospital, Ebola kits for workers are ready to go. Dr. Lisa Winston is an infectious disease specialist.
We feel like we do have the supplies and the training to be able to protect our healthcare workers here.
New protocols have been issued for 911 dispatchers to try to identify potential Ebola cases even before an ambulance arrives at a place like San Francisco General. For healthcare workers, Scott, even the smallest mistake with an Ebola patient could be deadly.
But there has been no transmission in the United States. John, thank you very much.